Hi, this is Dan Benardot. This is part two of our introduction for NUTR 4960. So as we continue this discussion, I just want you to know that there's conflict in the athlete world about how much to eat. To some extent, the conflict comes from the fact that resistance or drag is very important, and that's a weight issue and how big you are. So the athlete's ability to overcome the resistance or drag associated with a sport is very important. I'm sure you can visualize cyclists who are wearing very aerodynamic clothing. They're wearing aerodynamic hats, and their bikes are aerodynamic because air resistance constitutes a huge barrier to going faster. It's a very real issue, and if you're smaller and you have a lower air resistance, you don't have to burn as much energy to go the distance, and if you have more fuel in the tank, you can go the distance faster if you don't run out of fuel. So being at a slightly lower weight sometimes causes athletes to restrict their intake. Sustaining power output is also important. So those are conflicts because to sustain power output, you have to eat, and to overcome resistance or drag, that's often interpreted as having to eat less. So it's one of the reasons why in the earlier slide I showed you that athletes tend to undereat and they tend to backload their intake. So these are things that are resolvable, but we have to be sensitive to the fact that these conflictual things associated with sports performance exist. There are a lot of issues in sports nutrition. We're going to be talking about these issues over the course of this class, and we'll take it one point at a time. So we'll talk about carbohydrates, fats, proteins, vitamins, minerals, fluids, and so on. So we'll cover each of these topics with a great deal of specificity. Just a brief note on chronic diseases. I mean, clearly all industrialized nations suffer from an ever-growing list of chronic disorders, cancer, heart disease. These are very often related to obesity, as is stroke and diabetes. So, these are important issues. So you have to ask yourself, is it genetics? Is it lifestyle? Is it the environment? And, if you look at these issues, just think, what disease rates could be reduced if you increase physical activity, and the effect of doing so reduced overweight and obesity? I mean, you'd have a big impact on a lot of those disorders. Then you have to ask yourself, what are the barriers to increasing physical activity? And how do you reduce overweight and obesity? I mean, very often our environments don't make it easy for us to actually go out and be physically active. So think about what it would take to reduce the barriers for physical activity, which would then make a big difference in reducing overweight and obesity. But we have to be careful because these are not just physical activity issues. They're how can you dynamically match energy intake to the energy expenditure with a physically active person so that they don't reduce muscle mass, so that they don't increase fat mass, so that the physical activity is very productive. Interesting issues, I think. I don't think there's any question. If you look at the CDC data, if you look at the World Health Organization data, that in so much as physical activity helps to lower body fat levels, it has a tremendous impact on reducing coronary heart disease, hypertension, colon cancer, diabetes, osteoporosis, osteoarthritis, the risk of falling, the obesity rate itself, and it reduces the risk of poor mental health as well. So many issues could be improved. In nutrition research, there are different levels of nutrition research. So epidemiological data are, you analyze a large group of people and you find that, gosh, these people tend to have higher body fats and they tend to have higher rates of cancer. Now that might be a spurious relationship, but it's evidence that those two things might be related. Very important because in epidemiological research, if you find that evidence over and over again, you become increasingly convinced that there really is something there. But more importantly, it motivates you to do some kind of experimental trial to see, okay, if I actually cause people to become more overweight, then in these people who I've caused to become more overweight, is there also an increased risk of heart disease? That is, do they show now signs of hypertension and more myocardial infarcts and so on. And then you can do a clinical trial where you really get large groups of populations to see if those relationships are so. Very often there's a lot of contradictory evidence, and it can be very confusing. Free-living humans are very hard to control, and there are a lot of factors that influence, what you might be looking at. So multiple studies typically are really important to really prove that there is some kind of relationship there. And there are all kinds of studies. I'm going to show you one of them, a study by Jean Maillet, but there are some studies from Stanford, Cornell rat studies, where you kind of say, what we thought we knew, maybe we don't really know. But let's look at the Jean Maillet studies. This is a very early study. He took people who were sedentary, that is, didn't move very much, took people who did moderate activity, and then took people who did exhaustive activity. And if you look at that, basically it's a straight line increase in energy expenditure. That is, the more active you are, the more calories you need to satisfy that activity. So it's a straight line upward as you go on this continuum. Ideally, you would want appetite to match physiological need for calories, right? That is, you would want to eat what you needed to eat. But if you look at it, if you're very sedentary, there's a tendency for people to eat far more than they need to eat. That is, appetite far exceeds actual physiological requirement. And then as you start to approach moderate levels of activity, then there's a very close match between appetite and physiological need. That is, you tend to eat what you need to eat. And then in the exhaustive area, there's a big drop-off in appetite. That is, you get exhausted, your appetite drops, you tend not to eat what you need to eat, but then when you recover from the exhaustive activity, you tend to overeat a little bit. So it's pretty clear that this area of moderate activity is really a nice place to be, because your appetite tends to work with you in making sure that you take in what you need physiologically to take in. Another thing that's important to consider is that that even though carbohydrates have a bad name, the more intensity of the activity that you're doing, the higher that intensity, the greater the proportionate requirement for carbohydrate to satisfy that need. So if you look at this, if you're walking, maybe 40% of the energy that you're using comes from carbohydrate and the remainder coming from fat. But look at what happens as you increase exercise intensity. You get a very definite increase in the proportionate contribution of carbohydrate to fuel that activity. So carbohydrate is important, and people doing very intense activity tend to diminish its importance. So if you look at football players, if you look at sprinters, they're all about protein. But maybe they should be just a little bit more about carbohydrate, because that might be exactly what their bodies are seeking. And if you look at this early study by David Kostel, did a very nice study. He looked at how long can people exercise before they're trained. And basically he found that before training, this group of people, before he separated them into two different groups, could go about 35 minutes in training. Then he split them up into two groups. One group had a relatively low carbohydrate intake, another group had a higher carbohydrate intake. And look at the difference. The higher carbohydrate intake was able to exercise much longer, 102 minutes on the high carbohydrate diet after 7 weeks of training. But the lower carbohydrate group, now clearly there was a training effect there. They were able to exercise far better, almost twice as long as they did prior to training. But look at how much better it was if you had enough carbohydrate in your diet to help your muscles get the fuel that they needed in order to do the work. So be very careful about diminishing the importance of carbohydrate. And it doesn't matter who you are, if you're exerciser, non-exerciser, the distribution of calories looks like it's about the same, with majority coming from carbohydrate. And a lot of people are worried about insulin, but people who exercise, really the insulin response to carbohydrate is not so bad. I mean, if you look at a 53% carbohydrate diet, blood insulin, and then as people exercise on a slightly higher carbohydrate diet, the blood insulin level drops. I mean, but what that means is that the tolerance to carbohydrate is far better with exercise. So people who are exercising don't need to be as afraid of getting a hyperinsulinemic response to the carbohydrate because they tolerate the carbohydrate better, their muscles can use it better, they're less likely to make fat out of the carbohydrate that they're consuming. So that's really important. And then even intermittent activity is important. And this study done by Mark Davis out of the University of South Carolina showed that if you're not really taking anything during the activity, you can do 60 minutes, 15 1-minute sprints completed on a high carbohydrate diet and a snacking protocol, 87 minutes with 22 1-minute sprints completed. So carbohydrate delays fatigue during intermittent activity. One of the reasons why it's important to have a carbohydrate-containing sports beverage during training and competition to allow the athlete to go better, go faster, do more work. And sometimes people don't understand what a good sports beverage really is, but if you look at something like Gatorade, which has about a 6 or 7% carbohydrate solution, there's no statistically significant difference here between water and Gatorade. They're about the same in terms of the rate at which they get absorbed and leave the stomach. But if you look at Powerade, it's a little bit different, a little bit higher. There's a delayed gastric emptying here, so that means you can't drink as much because every time you drink, you're going to add to what's remained in your stomach. So it might inhibit total fluid consumption. The solution is pretty simple. Before you exercise, you just take a drink of that Powerade bottle before you start, fill it with water, fill that whatever you drank with water. Now you're down to about a 6% solution, and you get a fast gastric emptying. But look at, think of something like orange juice. Orange juice is about 12% carbohydrate. It makes a terrible sports beverage. It doesn't have any sodium in it, and it's way too high in sugar. But a lot of people are consuming fruit juices. So we need carbohydrate because it improves performance, but you can't have too much because if you have too much, it stays in the stomach, and then you end up with problems. And if you have fluid by itself, it makes a difference. If you have fluid and carbohydrate, it makes an even bigger difference. If you have fluid and carbohydrate and minerals together, like sodium, a little bit of potassium, it makes an even bigger difference. So if you have a sports drink that has sodium, carbohydrate in it as well, then you tend to do better longer. It makes a really nice difference. So, the ultimate question for people who are in health professions, which is, what can you do to help the physically active person stay on the right side of the fence so that they can be at the level of supreme fitness, but also avoid injury or breakdown? And so we're going to be discussing those facts. That is and we're going to stick to the science. Let's stay away as much as possible from the emotion of the issue. And let's just stick with what the science tells us, because if you try to apply the science, it actually really works, and it's the best way to go. And that's what we're going to be doing in this class.